Hello, this is Molin Chigoma. I'm from Filipino Institute and I'm going to talk about anxiety disorder. What is it? What is it all about? It's a vague and uneasy feeling in response to stress. What are the signs and symptoms of anxiety disorder? You can feel a lump in the throat, really hard for you to swallow. It's like it's so heavy here. Butterflies in the stomach. Oh my god. Tell me. You feel butterflies in the stomach. Butterflies. Pulse rapid. Respirations are rapid. Blood pressure may increase. Your mouth might be dry. Sweating a lot. You sweat a lot. There is urinary frequency. Loss of appetite. Feeling nauseous when people are around. What are the risk factors of anxiety disorder? It is believed that genetic and environmental factors lead to anxiety disorder. Often in interaction with others are, risk factors for anxiety disorder. Some specific risks are childhood shyness from the very age when you were young. You used to be shy, you just want to be alone, you don't want to associate with anybody. Anxiety disorder includes biological relatives or parental history of anxiety disorders. Like your grandfather had anxiety disorder, that can also be a risk factor. Lack of economic resources, exposure to stressful life events. Like every day you are stressed. In every day of your life you are thinking about money, you're thinking about your family back home, you're thinking of every situation. So stressful life leads to a normal human being, a normal person having anxiety disorder. Elevated afternoon cortisol levels in the saliva. Uh, so, what are the treatments for anxiety disorder? There's counseling and psychological therapy that you need to go through. There's changing of unhelpful thoughts. Unhelpful thoughts are really a very big risky. So you have to change that you have to think positively in order for you to get through this situation. And behavior, sometimes the behavior will just change and you need to go for behavior therapy. And medication, there is also medication for anxiety disorder. A thorough mental health evaluation for anxiety sufferers is recommended, as anxiety disorder are often recommended as related conditions such as OCD or depression. This leads to depression. Anxiety disorder will lead to depression, and once you have depression, it's really hard for you to get back to normal because you'll be depressed, you'll be stressed, you are living a stressful, depressed life. In order to get rid of all this anxiety disorder, you need to get help. Thank you.